Hello everybody and welcome to another Facebook Live. And today I am joined, myself, Guy Cappuccino, you know me, Helene Taylor, she's our nurse who's going to be talking about BBL and hands today, Angel Zirkle over on the right, and Renee Plazek. So we got the whole team here at Guy Cappuccino and LaBelle Medi Spa, the whole medical team. And so we're going to be talking about lines in the neck, spots, how to make the skin look better on our hands and our necks, often forgotten about. If you have any questions, just type in and we will get back to you as soon as we can. All right, so what should we talk about first today? Talk about hand volume.
Let's talk about hands.
All right, so tell me what common concerns do people have when they come in talking about their hands?
That they've lost the volume between their knuckles on the hands, and it looks veiny and older than the rest of them.
And that's really because we've lost volume.
Right.
Yeah. Right. So we need to talk about options to replace the volume to kind of hide that tendony, veiny look, unless you like that, which I do, obviously. All right, so what do you have in your hand right now?
So we have a filler. It's called Velour that I love to use in the hands. It lasts about a year, I find, if not more.
Okay.
I typically use a cannula. I numb it a little bit, use a cannula right about here, and I just go in and I add some volume and do a little massaging. It's pretty, is that how you do it?
That's how I do it, yep.
And it's pretty easy.
Well, what can people expect after procedure? In terms of downtime or pain or anything?
Maybe some bruising. There is lidocaine in the product, so it might feel a little numb for a little bit, but that's short term.
Right.
Short term.
Right.
A little. Some people have some swelling, but it's minimal. They can ice.
Right.
Too.
Right. And like always, whenever we have a procedure done, we always say it's not going to look its best right away, and it can be a week or two. But of course, we'll hold your hand through it. So Velour is a hyaluronic acid filler. It's a temporary filler. In the hands, what do we say, like a year?
Year,
About
14 months.
Yeah, right, duration. And Renee mentioned using a cannula. For those who aren't familiar, a cannula is like a needle in that it's a long, thin tube that dispenses product, but instead of having a sharp beveled tip, which can cut through tissue, it is a smooth, rounded tip, and that will have less trauma, which leads to less bruising, less bleeding, and less discomfort. So it's an ideal way to deposit product in an area like the hand. All right.
I would say it depends on the hands. I may use one syringe for like half in one hand, half in the other. Sometimes I've used a full syringe in each hand.
I could imagine.
It's very rare that I do that, but
yeah, I could imagine that. All right, so then I guess the next thing people would complain about would be sunspots, dyschromia. So that's where Helene's going to talk a little bit about the most effective ways to get rid of brown spots.
Okay, the most effective way is something called broadband light. You might know it as IPL. It's not a Brazilian butt lift. It is broadband light. So think of that as color correction. So anything on your hands, any brown spots, on your neck, which is poikiloderma.
We'll get there now.
So women have it menopausal time with the sun. Women can look in the mirror and you can see a big brown. You probably can see it right now, brown and red. Now,
No, you're
they're
they're
going to look in the mirror, and that will be treated with broadband light. So broadband light, it basically would go like this and across. And there's two filters, just to go over real fast. What is the difference? A 560 is the red therapy. People always talk about, oh, do you have red therapy? That's what we have. It does not only correct the redness, it also rebuilds collagen and fibrin over time. So it is a skin rejuvenation treatment and a pigment correction. Then there's a second filter we put in, 515, which goes a little more superficial for brown spots. So anybody with brown spots, red spots on the chest, the neck, or the hands, we do the skin correction, pigment correction, and skin rejuvenation at the same time. And it correlates very well with what you guys do and work as a great team and collaborator, right? And there's a lot of times they'll go over and see you guys for the neck or the chest, and you're like, wait, we can do a laser, but then you still have the color because you can't. Nothing you guys do addresses the redness.
Right. So first thing we talked about is volume. Now we're talking about color correction, which is great. So is it one treatment? Is it multiple treatments?
Usually, because if it's just browns, I could do it in one because it's just melanocytes just hanging out that I can basically
bring up to the
laser
surface
in one. If it's alive, it's vessels, it's capillaries. It takes about 3 to shut it down.
But correct me if I'm wrong. With the hands, it's usually more
brown. It's always brown.
So usually
correct.
one treatment. do you numb it first? Does it hurt? What happens?
We do have numbing cream. It's up to the client. The hands don't really hurt. The neck doesn't hurt. The face hurts.
And one good thing to say is we can do it all at the same time. We can arrange the schedule
Correct.
so we can do both at the same time.
Yeah, and if you did the filler first, then you have a little bit of anesthetic in there from the lidocaine.
Yes.
Perfect time to go ahead and do color correction. Yeah, it's a great explanation of broad-based light BBL. Those filters are just changing the wavelength of light that is absorbed into the target. So for browns, we talked about the 515 nanometer wavelength, and for the reds, we're looking at 560, which also does induce collagen. So it is an anti-aging modality as well. Just a fantastic technique. Okay, now what about texture? We talked about volume. We talked about color. What if I have crepey skin, or some fine wrinkles, or just sun damage? What would you guys recommend for that?
A good hand cream.
Oh, okay, that's a good start.
Yeah. And actually, what I do is I put my retinol on my face, on my hands every night. So
Yeah.
retinol,
That extra, hydration is really going to help the skin not look so crepey and wrinkly and dry looking.
That's probably a really good first step.
And peels, because the more peels you do, and you take off those layers of skin, it makes the skin rejuvenate, more layers of skin, and stronger and less crepiness.
Yeah, the same thing we've talked about in the past. Anything that's going to increase the cellular turnover, get rid of the dead skin cells, and stimulate more growth. So obviously hydration is the first step. That's nice, plump up the skin, make it look better. But yes, chemical peel will also take care of that surface layer, as well as a laser like halo or micro laser peel.
Micro laser.
Would be great. Right.
Yeah.
So we can really correct everything pretty straightforward.
We were just talking about gel nail polish, where we were
Okay.
under the light. You need to protect your
Beautiful.
Yes, UVA.
Yes, thank you. I did this myself.
You were saying that, the gel
You
overlay.
need to put some
I have the
sunscreen
hands. I
on
have the actual hand mittens.
before you have your nails done. And remember that
Why?
when
Because they do like a UV cure.
Yeah,
Yes.
you do
Your hands are
Oh, that's so
And
smart.
that is into your hands. So they make little mittens I have that don't have hands. You put your hands in.
don't have your
But
fingers.
you can just put sunscreen on easily.
Sunscreen,
too, right?
yeah.
The same thing when you're driving, right? Your hands are always up there in the sunshine.
I know. In fact, I don't know if you can tell, that my right hand's a little bit more pigmented than my left from golfing.
From
So I love it.
golfing,
And I
yeah.
put sunscreen on.
Yeah.
It's in my golf bag. I really do every single time I play.
Yeah.
And you can still see that my right hand's got a little bit more pigment than my left. It's going to be interesting to see as I age. Terrible. All right. So that kind of covers hands, right?
Yes, that covers hands. What else?
Thought about hands, the palm,
Oh, talk to me.
hyperhidrosis.
Oh.
If you've got really sweaty palms,
Sweaty palms.
you don't have to just live with it. So
right.
we can use Botox injected into the palm to help slow down that heavy, excessive sweating.
That's right. Yeah, I've done that.
I've done
Yeah.
it to
That's
one of my kids.
really gratifying.
Yeah,
Yes.
he loved it. And it lasted for about 5-6 months for him.
Yeah, I've seen that too as well, especially in the summer months if people, are concerned about being sweaty.
We're going to a meeting that they need to shake a lot of hands.
Yeah,
Yeah.
no, that's a great thought. I know, I know it sounds awful, but I've done it a number of times, and what I've done with my patients actually just put some topical on, put a glove on, and I let them sit there for 20 minutes, 30 minutes, and then with the tiny little 30 gauge needle, it really isn't bad at all. And we're not doing the whole palm, we have a way of targeting, so we know where the excessive sweat gland production is. So, yeah, great thought.
Yes, I do.
All right, awesome. Okay, we're going to talk a little about neck skin. A lot of these things are going to sound very familiar, so we're not going to repeat everything. Like for Helene, she already talked about reds and browns. It's going to be pretty much the same. However, we've been starting to treat more of the fine transverse necklines that people will often complain about. And this is something that's good to talk about today because there really aren't good surgical treatments for it. And we're not talking about surgical treatments today. So how do you address those when people come in and talk about those lines across the neck?
We have a really great product, Redensity.
Agreed.
This is a hyaluronic acid filler, and it's used specifically for superficial lines. Not just on the neck, but it is great for the neck. So it's a filler that can be injected not real deep, right underneath of those lines, and it's not going to leave you with a residual lump or, what am I trying to say? You know what I'm saying? Yeah. And it smooths out nicely, and then over, up to 2 weeks, take some time for it to settle and do its thing. You're going to see those lines soften. Not necessarily go away, but it's definitely soften up.
Right, and that's everybody I've seen with that has been so happy with it. I guess the biggest risk there is bruising, like any other spot. You do have to use a needle for that.
Yeah.
I do tell people after the necklines that to do some massaging, but because they tend to
Yeah.
really look a little lumpy for about 2 weeks.
And a lot of that's a swelling too, right?
Right.
Because you're only injecting that one spot. So yeah. That
And
makes
a lot of
sense.
people's necklines bifurcate and trifurcate, so it looks like a creek, if you would,
Yeah.
right? A river, and it's
Right.
sort of, so there's a lot of injecting going on.
And one of the things that I've noticed, and I tell a lot of my patients, even though the temporary fillers are gone theoretically in 4 to 18 months, there's always a residual benefit, and part of that is just from the very needling that we're stimulating some collagen production from the trauma of putting the needle in, and then the filler seems to stimulate a little bit of permanent collagen correction. I've seen that with lips, people who have had lips done over the years, and all the filler's gone, but their lips still look nice.
Right.
So that's something that I've personally experienced.
Yes.
No, what about a non-surgical correction for bands? What if we have neck bands here and someone's not ready for surgery, or they have just muscles that kind of tent out?
That's a Botox.
Yeah.
That's
Yeah.
super easy. Couple of injections all the way down those bands, and you walk out of here sometimes with some bumps all over, but once that settles down and everything's absorbed, give it a couple of days, up to 2 weeks to kick in, and you'll see those soften up and they won't pull so much.
Right. I guess it's worth talking about Kybella a little bit, since we were talking about non-surgical treatments of the neck. So for those who aren't familiar, Kybella is an injectable product. It's deoxyfolic acid, and it's FDA cleared for submental fats. That's the fat under here. And then there are a number of off-label usages, but essentially will melt that fat. In my experience, I'll just take this one, I really prefer it for very small areas of fat. You can treat larger areas, but then the number of treatments becomes 4, 5, 6. And at that point, the decision is probably better to do liposuction, which can be done in the office and your local, and have it done in one. But there are people who have a great indication just with a small amount of fat somewhere. I'm not going to talk about off-label usages, but in the neck, chin, jawline area, that we can get creative with injecting Kybella.
Mm-hmm. It's nice.
Yeah.
All right, let me see if we have any questions. Any questions?
No, good.
Okay, good. All right, well, thanks everybody for joining
Thank you.
us.
Thank you.
And if you have any questions, be sure just to type them in, even if you watch later. We will do our best to answer. Thanks for joining us.
Thanks.
Bye-bye.